Journal Record Capital correspondent Catherine Sweeney joins us with more stories making news in business this week. Catherine, thanks for joining us.
Thank you for having me.
Now, the state insurance commissioner, John Doak, likes the new short-term cheap health insurance policies that are now available. What's his thinking here?
The Affordable Care Act, also known as Obamacare, required people to get health insurance, but health insurance is becoming more expensive to buy. These health plans are cheaper because they cover fewer things. So a lot of them don't cover mental health services or prescriptions. That makes them easier to buy for people who have less money. But critics of those say that because they cover so few things, they're only good for people who don't need them.
Yeah. Now, Oklahoma is now the second in the nation in the number of people per capita without health insurance. What's driving this number up?
There are a ton of things going on here, but like I said, insurance is getting more expensive, and that's for several reasons. Oklahoma has higher rates of poverty, we have worse health outcomes, so that drives prices up. And in a kind of a self-perpetuating problem, high uninsured rates also drive insurance up. Health professionals and analysts are saying that if Oklahoma expanded Medicaid, that would help some of the problem. That would offer Medicaid to the working poor instead of mostly children, seniors, and the disabled.
In a different story, the shortage of people with commercial driver's licenses continues to grow, as does the waiting list to take the test. Now, how is this issue being addressed?
There are two lawmakers who are really invested in this. That's Marcus McIntyre, the representative in Duncan, and Avery Fricks, the representative in Muskogee. They're seeing really long wait times there. So across the state, the average wait time is more than a month in some situations, but in those areas it can be several months because there is so much demand. The Department of Public Safety oversees that program, and they've been getting their funding cut, so they've had to get rid of testing positions and have hiring freezes, several things like that. So lawmakers are trying to think about how they can better fund the Department of Public Safety, and they're also looking at ways to get third-party contractors who work in the private sector to come into Oklahoma.
Now, this affects trucking companies as well, right?
It does, and the oil and gas industry and the agriculture industry. So those are two of the biggest ones in Oklahoma.
And the state is trying to show the auto industry that it wants them back. What's the latest?
Oklahoma was actually in auto manufacturing for decades. We made some of the first cars here, but that ended in 2006 when GM closed its plant, which was the final one. Oklahoma is working with the business community and the government to try to get this industry back into Oklahoma. And one of the biggest things the government is doing is implementing a tax credit that looks like another one we already have. So we have breaks for the aerospace industry to get engineers into the state. We give them tax breaks. We give the employers tax breaks and the engineers themselves. So we're looking at doing that for the auto manufacturing industry.
Catherine Sweeney from the Journal Record, thanks for joining us.
Thank you for having me.